Hi everyone. This week we're going to be discussing health promotion and the family. Um, and this is illustrated quite well in the Edelman book, Chapter 7. It uses family theory, systems theory, and developmental theory and risk factor theory to help guide the nursing process with families. There are 11 functional health patterns, and you'll see if you look back on Chapter 6 to establish the structure for the interview questions during data collection, which is really important. So when you are interviewing the patient, it is of paramount importance to be in an environment that is welcoming, relaxed, is providing an opportunity for open communication, and where we are not judgmental and we are listening, actually listening. It isn't fair to the patient for us to be documenting on our computer while they're speaking. They know very well that we're only listening to half of what they say. So what I do with my patients is I give them my full attention. I may have a pad and paper in my hand to jot down things, but not working on the computer unless I say to them, "Excuse me 1 minute, I have to document this." I'm looking at them eye to eye. Um, I am making appropriate hand gestures and nodding my head and agreeing with them, or asking questions, clarifying questions. All of those things are important in the interview process. The evaluation phase of the nursing process categorizes these data within stages of family development. From the analysis and nursing plans are formulated. Um, and we look at the cognitive development of children in assessing individuals, but not actually when we are talking about family assessment. Family assessment is a different matter rather. Okay, let's talk about family. In this day and age, family is um, very different than what we contextualize as family 30 years ago. So, family is actually interacting individuals related by blood, cohabitation, or adoption. And they interdependently perform relevant functions through expected roles. So they have expected roles in their family unit. Now, most of the time, the central influence in individual and family development, behavior, understanding, and attainment of health and health behaviors is related to this family model. So they get their um, patterning diet, their activity, hygiene, coping. All of these things are modeling behaviors of others in the family unit. Um, and it is that's one of the reasons it's so important for the I guess what I'm going to call it. I don't want to say parents because nowadays that is defined in so many different ways, but heads of the household must uh, have modeling behavior because that's how the other people in the family unit are going to um, adopt, like their diet, their exercise, whether they are active, their hygiene practices, coping. All of those things are obtained through mimicking the leaders of the family unit. Okay, so let's talk about a comprehensive family assessment. And this isn't something that's done on your average, sick visit or blood pressure check or any of those things. These things are done at the annual physical, um, and they should be done on an annual basis where you are reviewing the dynamics of the family so that you can assess support groups and making sure that things are needs are met. You've heard social determinants of health a zillion times throughout our coursework, and that's part of the process of a family assessment. So in a family assessment, we're going to consider the family as a group, but the member that we're interviewing is an individual. If we have the family there, we're going to listen to the family, we're going to listen to the individual, engage in dialogue, recognize different patterns of behavior, and assess the potential for active positive change. Developmental framework and risk factor estimate approaches. Our role as the advanced practice nurse is to collaborate with the family, provide information, and decision making, problem solving, and we are a liaison for services. So we refer as we find is needed. Now, when we are assessing these family members, we are um, I'm doing it as an individual. Okay, so someone comes in for an annual physical. We check out all of the physical stuff, but we do a lot of assessment on family assessment or individual assessment. We check out for violence, and we ensure their vaccines are up to date. All their screenings are up to date, and um, we provide referrals and orders as needed. Um, Also, it's very important to try to identify risk behaviors. And for example, if someone smokes, I am going to try to get them to stop smoking, but I have to be very cautious in how I do so. So, motivational interviewing is something that we've talked a little bit about in the past. I'd like to delve into it a little deeper because I find it works really, really well when you're working with patients who have behaviors like um, smoking, alcohol use, non-compliant diabetics. It really is a good way of helping them change behavior because we do it as a small test of change. Now, what does that mean? We don't tell them quit smoking, okay? And we also assess when they're ready. If we have asked the question and they say, nope, I'm not ready, that's it. Interview stops there. We are not going to push the patient. They know they shouldn't be smoking. We aren't going to make them feel bad. I had a student once, I was precepting, and she asked the patient if they smoked, and they said yes. And she started to go into this lecture. She went into lecture mode, and I had to interrupt her immediately. And I told the patient, you know you're not supposed to smoke. When you're ready um, to begin the process of quitting, we're here, and we will work with you through that process. All you have to do is let us know, and we'll help you. And he was fine with that. But um, utilizing a judgmental manner never works. It only turns them off. All right. Now, let's take a look at these concepts here: wellness, promotion, health protection, and disease prevention. All right. So, it's it seems pretty simple, right? But it can be challenging. So, if I have a patient, just an average patient who's coming in, say for an acute illness, I look through their chart as I prior to my initiating a visit with them, and I identify whether or not they're up to date with all of their screenings. And as a nurse practitioner, you'll need to learn when those screenings are appropriate, and you'll need to keep up with it. It was that the first colonoscopy should have been done at 50. That's the way it was for years. Now they've changed it to 45. Mammogram has changed as well. Pap tests have changed as well. Used to be every year. Now it can be every 3 years if you've had so many negative pap tests in the past. So make sure that you're up to date on all of those things. Um, in fact, I think while I am here, I am going to take a peek at something. Okay, so let's look at health screenings. Now, this is for your average adult, right? All right. So they should have every year a physical to check height and weight, BMI, and we're going to ask them about diet, exercise, alcohol, tobacco use, medication, blood pressure, and cholesterol. We're going to check for all of those things. Um, Blood pressure should be checked every 2 years in adults that have a healthy blood pressure. Um, it can be good. We know blood pressure can be a good indicator of other things, right? Boop, 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 boop. I'm looking up some stuff here. Bop, 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 bop. And I'm not finding it. So, hopefully, you'll go in, look for screenings, and you get it in your notebook, your little pad that I tell everybody to carry. I don't know if you are or not, but if you do, have it in there of when pap tests are due, mammograms are due, colonoscopies are due. Let's talk about vaccines. Tdap every 5 years, shingles at 50 or above, Pneumovax. Pneumovax is 60 or Prevnar 20, 65. But if you have health problems, sooner. So I got the pneumonia vaccine in my 50s because I have asthma. So you have to know those things as a provider and ensure that the patient is getting them. Okay, so that's all about wellness promotion. Um, if a patient has an elevated BMI, what are we going to do? Oh my gosh, we have to try to come up with some help for these patients, right? We can't just write that the patient has a BMI of 35 and forget about it. We need to document that we've discussed methods with the patient. Um, Many health systems have weight loss programs. Mine does. Um, and there are, oh my gosh, there's so many options now for patients. We've got Wegovy, which works phenomenally if patients can tolerate it. Um, all sorts of different um, interventions that could be done for patients with a large, high BMI. I worry the most about children with BMIs that are elevated. Um, got to get those down, and teaching is of paramount um, concern with these patients. Disease prevention, and we want to utilize appropriate treatment models for all of our patients across diverse healthcare delivery systems. We have to respect our patients' culture when we are discussing these particular interventions with them. All right, let's talk about family-centered care. And what is family-centered care anyway? It's a healthcare model, and it focuses on the needs and values of the whole family rather than the individual patient. It's a values-based approach that involves forming therapeutic relationships between patients, family members, and healthcare providers. It's considered the standard of pediatric healthcare by many hospitals, healthcare groups, and clinical practice. And what are some of the principles of it? Some of the principles related to family-centered care is dignity and respect, listening to and honoring the family's choices, information sharing, communicating and sharing complete and unbiased information with the family. We want the family to be involved in healthcare decision making. We work with the family to set up goals, strengthen the capacity, and make decisions. We want to ensure that the family has access to the care that they need, and we help the family manage stress and coping, decreasing conflicts as able. So, some of the examples of how we can incorporate family centered care into our healthcare process is learning and using the names of the patient's family members, discussing the patient and their family's cultural traditions and backgrounds, and providing different ways to share key patient information like diagrams and written summaries. I use drawings a lot with my patients to try to illustrate what's going on with them physically. Um, Remember, there are different methods people learn best, and some prefer um, auditory, some prefer visual. So we need to incorporate that method into our healthcare.